Hello everyone, my name is Kate Hooper. Today I'm going to be discussing something many people believe to be taboo, which is death. When death comes to mind, people often think of fear, uncertainty, pain, or suffering. If you had the option to limit these feelings with your own death, would you? This question is often brought up in association with physician-assisted suicide or voluntary euthanasia debates. Physician-assisted suicide has been a heavily debated controversy dating back hundreds of years with the dawn of modern medicine. The aim of this form of suicide is a palliative one, in allowing a terminally ill patient to end their lives painlessly on their own terms. Examples of these types of terminal illnesses could include ALS, end-stage cancer, or chronic heart disease. In physician-assisted suicide, the licensed doctor can provide the means necessary to end the patient's life, such as prescribing a lethal dose of medication. The most common medication prescribed is called secobarbital. The lethal dose is 9 grams and is consumed as an oral liquid. Since it is normally prescribed for insomnia, people report often drifting into what feels like a deep sleep. Meanwhile, in voluntary active euthanasia, the physician takes an active role by administering these medications themselves. Despite the disparities, both physician-assisted suicide and voluntary active euthanasia provides a peaceful death to consenting terminally ill patients through evidence-based lethal medications. Although legal in several jurisdictions like DC, Oregon, and Washington, this topic is still heavily debated. While it has been said that legalizing assisted suicide would be a gateway to other issues, I believe that it allows those who have terminal illnesses to come to terms with their death as well as take control in it. As a general practice, physician-assisted suicide is accepted to be moral since it eases the suffering of terminally ill patients and allows them a peaceful death on their own terms. The editorial, Physician-Assisted Suicide, by Dr. Donald Boudreau, examines the story of patient John Wallace, a 72-year-old man from Washington with metastatic pancreatic cancer. At the time of his diagnosis, Mr. Wallace had to be placed on end-of-life care. Death from pancreatic cancer is gruesome and slow, as the body ultimately wastes away from a lack of sugar uptake. Rather than die in this cruel manner, Wallace elected physician-assisted suicide so that he could die in the comfort of his own home, eating his favorite meal and surrounded by his family. Boudreau, and myself, argues that every person deserves to choose their own death, and that part of medicine is to maintain comfort and promote the patient's wishes. If a patient would rather end their life than to give in to their own suffering, I believe that should be considered an essential part of modern medicine. Legally speaking, physician-assisted suicide already has a precedent in multiple jurisdictions, like Oregon. In 1997, Oregon passed the Death with Dignity Act, which legalized physician-assisted suicide. Special Report, Legalized Physician-Assisted Suicide in Oregon, the second year, is a study conducted by Dr. Amy Sullivan, which revealed that the process for this service is extensive and is not taken lightly. Sullivan interviewed numerous physicians who all reported that their patients felt a loss of autonomy and an inability to participate in services that were previously enjoyable, and a loss of control over bodily functions. As for statistical analysis, Oregon's Death with Dignity Act did not dramatically increase the number of total annual deaths, which is another argument against this service. Additionally, many patients from states without this service obtained other means of ending their lives, such as poisons, in case their suicide request in the legalized states was declined. Taking unprescribed medications is very dangerous, since the dosages are not proven or regulated by the FDA, and the patient could end up suffering even more as opposed to the desired result of death. Therefore, physician-assisted suicide should be made legal nationwide using Oregon's format in order to provide this necessary service without endangering patients. There are those who argue against physician-assisted suicide and for permissible reason. A common argument is that if a patient is able to afford quality palliative care, then the need and or desire for this service would significantly diminish. However, Euthanasia, the Role of Good Care by sociologist Clive Seal refutes this claim. According to a study, Seal explains that people who received hospice care were, if anything, more likely to have respondents who felt that it would be better if they had died earlier. Additionally, those who accept hospice care may be predisposed to consider the benefits of an earlier death through services such as physician-assisted suicide. Through these claims, it is clear that euthanasia and physician-assisted suicide is not the patient giving up on their own life despite good care, but simply the need to take control of their own end. Another argument against palliative care is the expenses. Palliative care can be extremely expensive, costing upwards of thousands of dollars related to fluids, packed RBCs, oxygen tanks, and even ventilators. Given these arguments, I am asking you all to take action and make physician-assisted suicide legal in your own state. Getting involved in this campaign is simpler than you might think. If this is something that interests you, you can simply go to deathwithdignity.org and send a letter to your state's representative. To do so, fill out your information and why you believe this act should be legalized in your state. It took me no more than 10 minutes to do, and I strongly recommend that you all do so as well. Overall, the legality of physician-assisted suicide and voluntary euthanasia is a harshly debated topic. While some may believe that it allows needless death, it actually gives fatally ill patients a sense of autonomy in their own death, as well as relieving unnecessary suffering and cost to the patient and his family. By sending a letter to your representative, you can enact this type of change in your own community and speak out for those who cannot speak for themselves. Here are my works cited, and thank you.